Hey, good morning, everybody. It is Wednesday, November 20th. Wow, can you believe that? We're like a little over a week away from turkey and stuffing and all that stuff. Gosh, hope you guys have a wonderful holiday. Want to talk to you really quick about 2026 Medicare costs. Government finally announced a lot of things just in the last day or two, and wanted to get a video out to everybody so you kind of understood that. So going to talk a little bit about what to expect in 2026. First thing, the Medicare Part B premium, the amount that either comes out of your Social Security check automatically or you are paying for, that is increasing starting in January from $185 this year, the base premium, to $202.90. So $202.90 will be the amount starting in January that's going to come out. Good news is this is a smidgen lower than what they originally projected it to be. It is still about a 9.7% increase over last year, but that's what you're going to pay starting in January. Also, the Medicare Part B deductible for those of you that have traditional Medicare and a supplement or gap plan, or even if you don't have a supplement or gap, the Medicare Part B deductible is going up about $26 to $283. This was $257 this year. It is going to be $283 in 2026. So you're going to have to pay the first $283 before you have coverage for any outpatient type of service. That's not a huge increase. I'm personally pretty happy with that. So wanted to make you aware of that. Also, on Part D drug plans next year, the maximum out of pocket next year is going up $100 from $2,000 to $2,100, meaning that is the most you pay for covered medications. Keep in mind, covered is that key word there, because a lot of these plans on these formularies, they realized that was the key word. So that's why, if you remember, a lot of these more expensive medications, some of your cancer, stroke, heart attack drugs, some of your asthma medications are not covered on formularies anymore. So those don't fall into or count toward this $2,100. It has to be a covered medication for it to count for this $2,100. Also, the Medicare Part D deductible. Most drug plans have a deductible, whether you realize it or not. The standard deductible next year is $615. Now, some drug plans have a lower deductible than that. This would be the highest deductible, $615. But we get a lot of questions. There's a lot of confusion. I do want to clear something up here. Most drug plans waive the deductible if your medications are tier 1, tier 2, which are your common maintenance type of drugs. And they're only going to charge that deductible for tier 3, 4, or 5 medications. So again, the vast majority of plans, you do not have to meet a deductible for tier 1 and 2 drugs. You would only have to meet your deductible, be it $615 or lower, if you're on a tier 3, 4, or 5 medication, which again can vary. So if you have any questions on this, just let us know. We can plug in your meds, tell you what tier levels they are, look at all that for you, make you aware. But a lot of confusion on that. And last thing I kind of want to touch on, and then we're going to go over to Medicare.gov really quick. Supplement plans, Medigap plans. We always get a lot of questions this time of year. Everybody goes, hey, Ryan, what's my new premium going to be in 2026 for my supplement plan? And most of the time, my answer is, I don't know. Why is that my answer? Because when you have a rate increase on your supplement plan, it is based on your anniversary month or effective month of when you started that supplement plan, not calendar year. Obviously, if you turned 65 in January and you got a supplement plan in January, then you are calendar year. But if you turned 65 or purchased your supplement plan in August, then you're probably not going to see a rate increase until August. And we won't know what that new rate is until about 30, 45 days before. So, July in that case. So I just want to try to clear that up because we get dozens, hundreds of emails and calls on this very question what's my rate going to be next year? And most of the time our answer is, I don't know that yet. It's probably going up, probably going north, but how much, not sure. So really quick, the other thing I want to do is kind of show you guys over here on Medicare.gov. I'm going to get out of here. I'm going to make myself smaller for a moment, and I'm going to go over here to Medicare.gov. So if you open up a browser and you literally type Medicare.gov, I'm sure a lot of you have been there, but maybe some of you haven't yet. If you go to Medicare.gov right here on the homepage, and right up here, click Basics, click on Medicare Costs. Scroll down just a smidge right here to learn what Medicare costs. Click on Get Costs. Now it's going to go through everything on hospitals, inpatient stays, skilled nursing facility, home health care. Now remember, if you have a supplement or gap plan, you don't have to worry if you have a G or an N about a lot of these hospital or skilled nursing costs because they're covered for you. If all you have is Medicare A and B and you don't have a gap plan, then you do need to worry about this. If you have a Medicare Advantage plan, this doesn't really apply to you. But what I really wanted to show you was down here on Medicare Part B costs, and right here when it says who pays a higher premium for Part B because of income. If you click on that, let me move myself out of the way and scroll down a little bit more to 26. This is where it tells you if your income is higher, what that income-related monthly adjustment amount, that additional amount you might be paying for Medicare Part B next year. So again, in 2026, government's looking at your 2024 tax return. They're always looking 2 years back. You can see if you file your taxes individually, $109,000 a year or less, or double that, $218,000 a year or less, you're going to pay the standard premium of $202.90 next year. But here's the different income thresholds, and the more you make, the more you pay for Medicare Part B. But that's where you can find it on the Medicare.gov website. Okay, let's come back here really quick and Okay, so we talked about all this stuff. Last couple things I just want you to mention. If you've never created an account on Medicare.gov, go to Medicare.gov, create an account with your Medicare number. It'll keep track of your deductible. You can order replacement cards. There's a lot of great information on Medicare.gov. So take advantage of the tools and all the information there. Stay educated. Watch all my videos either on my website, follow me on YouTube, follow me on TikTok. More info to come, but wanted to get all this stuff out to you. So take care. It's been great seeing a lot of you, and I still got a couple more weeks to see the rest of you, hopefully. So we'll see you soon. Talk soon. Take care. Happy holidays. Bye-bye.